Thank you so much, everyone. Thank you so much, Rebecca and the Life Raft organization for giving us an opportunity to speak about barriers to sarcoma treatment. So I'm Rashi Kapoor, and I am a sarcoma survivor, and I lead this patient support group, Sachin Sarcoma Society in New Delhi, India. First of all, we would like to mention who are we. So Sachin Sarcoma Society is a patient support group which is formed in India, and it was formed in 2018. Our mission is to spread awareness about sarcoma, desmoid tumors, GIST, and build companionship with their affected families all over the globe. Our vision is to remove the fear of these rare tumors. So, including me, all the members of Sachin Sarcoma Society have been patients, caregivers, survivors, and we have all taken treatment from Dr. Sameer Rastogi from All India Institute of Medical Science, which is one of the best hospitals in India. While we were undergoing treatment, each one of us have faced challenges like we were all misdiagnosed in our times. We all took wrong treatments. We faced a lot of mental health issues, so we had to undergo through a lot of stress and anxiety. And we were not aware about what is sarcoma. We have never heard about it. So there was lack of awareness. So in 2018, when all members who were all patients and caregivers, we all came together. We had one wish that if we would survive, we would like to help other patients. And the problems that we faced in our times, at least we would be able to help some other patients through our knowledge, our experience, and would be able to guide. And that is how our journey started as Sachin Sarcoma Society. It's not moving. यही बैठ जाओ इसको सुनो प्लीज Okay. So far we have been able to make an impact on 9,000 patients, and out of which around 8,400 sarcoma patients are there. There are 400 desmoid tumor patients, not only from India, also from abroad. And we have around a WhatsApp group where there are patients, 200 GIST patients. So we have international patients also in our support group, and there are patients from Canada, Australia, Thailand, Bangladesh, Nepal, Portugal, Cameroon, Iraq, Brunei, Afghanistan, and many more. Now, let's talk about sarcoma. So, sarcomas, as we all know, it is a very rare cancer. In fact, this is a paper which was published in 2021, and it talks about that sarcomas are ultra rare. This is a paper which was published by Connective Tissue Oncology Society, community of experts. And it talks about the fact that sarcomas are rare cancers, and this happens to 1 in a million. These are cancers which account for less than 1% of all adult cancers. Now before I speak about barriers to sarcoma treatment, let's talk and think about what the global research indicates. So we have come across this paper, The Challenge of Sarcomas. This was very well written by Roger Wilson in 2019, and it talks about the patient advocacy perspective. According to this paper, the challenges of sarcomas can broadly be classified in 5 categories. These are clinical challenges, challenges for healthcare system, cross-border challenges, keeping up to date, and research. Now, this is a global research, so this was published in that paper. Today, in our presentation, I would be talking about what barriers are there in the sarcoma treatment as per our experience and as per our interaction with patients that we do when we go to the hospital. So we also would like to classify that these challenges can be broadly classified in medical and diagnostics. As per this paper, which was published in 2019, this is an international paper. It's a survey which was done on awareness among the general population in Minnesota. It talks about the fact that sarcomas are very rare cancers, and there is lack of awareness about sarcomas in general public. So though I was from an educated background, but even when I was diagnosed with sarcoma, I had no knowledge about what exactly is sarcoma. So this is not a problem in India, but it is also a problem worldwide. Now, the second thing that comes, barrier which is faced in sarcoma, is misdiagnosis. So I would like to share a bit about my journey. I have been earlier into mathematics teaching profession, and I had faced first cancer in 2012. In second cancer, 2016, I had pain in my right knee. So I had a lot of pain and swelling. I went to various orthopedic doctors. I showed to them. They advised me to go for some painkillers. They advised me to go for hot water fermentation. I tried doing all that, but it was not at all affecting me. So finally, they told me to go for physiotherapy. I took 6 months of physiotherapy. Now, when it was not at all suiting me, I took multiple opinions from other orthopedic doctors. They also could not diagnose my problem. What is the problem? Finally, my pain was increasing, my swelling was increasing in the knee, and I was unable to walk properly. My gait pattern started getting affected. So when I went to show to some doctor, orthopedic surgeon, he told me that it is important for me to get operated. So I agreed for it. I said, okay, let's get operated. When he opened my knee on the operation table, he found that there is something suspicious. So that was the point when he thought that this is something very suspicious and it's important to send the blocks for the biopsy. So initially, when I was going to orthopedic doctors, they were suggesting that my diagnosis is PVNS. But when I went to the hospital and they did my biopsy, it came out as spindle cell sarcoma. So those doctors were not aware about sarcoma. They had not seen about sarcoma. And then they felt that it should be sent to some multidisciplinary setup of hospital. I was referred to AIMS. I went to meet Dr. Rastogi, and he got my blocks reviewed, and I got the diagnosis of synovial sarcoma. So I got so much of misdiagnosis from PVNS to spindle cell sarcoma to synovial sarcoma. So this happened with me, and it happens with other patients also. So what happens that India is a very big country. There are so many states, there are so many languages. Patients normally go to some general physicians who are not experts in sarcoma. They go to the local hospitals who do not have multidisciplinary setup. Sometimes if patients are told to go for surgery, they often go to a doctor who is not an expert in sarcoma. So the result of this is that they often go for recurrence. When they get recurrence, they get a lot of mental health issues. They face stress, they face anxiety. Also, there is a second situation that many times when patients come to multidisciplinary setup, big hospitals, before that they are told to get the biopsy done. But normally when these patients go for biopsy, their biopsy is done by a pathologist who is not a trained person in sarcoma. He has not seen significant number of sarcoma cases. So he goes to he normally diagnoses the situation, the sarcoma, which is not the actual sarcoma. So those pathologists have no idea about what is sarcoma, what is the importance of correct pathology in sarcoma, why are blocks required to be reviewed in sarcoma. Like in my case, it was X18, which is a molecular testing in synovial sarcoma, was not done. For Ewing sarcoma, EWSR1 is required to be done. So those pathologists, they do not do molecular testing. For example, in GIST, doctors are supposed to do c-KIT PGDFRA mutation testing. In fibromatosis, doctors are supposed to do beta-catenin mutation testing. So those pathologists have no idea about role of molecular testing, the role of NGS, and that is the reason patients face a lot of misdiagnosis, and they also get delay in the diagnosis. So when the delay in diagnosis happens, they start their treatments at a later stage. But this problem is not only in India. This problem, I guess, it is there in the worldwide. So, but we do have good hospitals in India. We do have All India Institute of Medical Science, where we are presently working. We have Tata Memorial Hospital. We have Homi Bhabha Research Cancer Center. These are dedicated cancer hospitals where sarcoma specialists are there, where sarcoma medical oncology departments are there, and significant number of sarcoma cases are seen in these particular hospitals. So another barriers that come in the sarcoma treatment, because it's a rare disease, it is so rare, it happens to 1 in a million. There is lack of registry. There is lack of funding because people focus on other cancers, but they do not have much focus on sarcoma. But also there are less number of clinical trials going on for sarcomas. However, in India, this situation is improving. So fortunately, Sachin Sarcoma Society has collaborated with medical health professionals, and we have contributed in 2 clinical trials, which are based on regorafenib study on synovial sarcoma and gemcitabine docetaxel trial study on synovial sarcoma. I'll be sharing the link of these 2 research papers later in my presentation. Also, another thing that we face is that in India, there are inadequate number of sarcoma medical oncologists. So there is a need to have more medical oncologists in our country. Let's talk about what is going on in the international field and what is lacking in India. So this is a paper which talks about the fact that avapritinib is a drug which is FDA approved for GIST. Riabritinib is a drug which is FDA approved for GIST. Now, these 2 medicines, these 2 drugs, riabritinib especially, is available in US, it is available in China, Taiwan, Canada, UK, but it is not available in India at the moment. Same is the case with avapritinib. Avapritinib is a wonderful drug which is FDA approved for GIST. It is available in US, but it is not available in India. Then we also see desmoid tumor patients. Desmoid tumor, now recently there is a paper FDA approved nirogacestat. This is a drug which is approved for desmoid tumors, but it is not at all available in India at the moment. So there is a need to do many things here in India as well. Now we'll talk about what are the financial barriers. So what happens that sarcoma treatment, it involves a combination of surgery, chemotherapy, and radiation, or a combination of any of the 2 of these things. So sometimes what happens that patients are required to take treatments from private hospitals, but the treatment in private hospitals is quite expensive. So this adds to a financial burden on patients. However, when patients come to All India Institute of Medical Science, where we are presently working, these treatments are done on a subsidized rates. In fact, no rates, and then it becomes easier for the patients. But also patients face problems in the insurance because most of their insurance coverage is not done, or sometimes the claims are rejected or they are not admitted. Now we'll speak about the barriers in sarcoma treatment based on social and geographical barriers. So what happens that India is a very big country. India has so many states. It has so many languages. People come from rural parts of India. Sometimes it is very difficult for them to travel to metro cities for the treatment. We also meet many patients in the OPD. Sometimes patients come alone. They do not have any caregiver, dedicated caregiver who can come for them, who can do all the running around, take instructions from the doctor. And sometimes the family support is missing. So it becomes very difficult for patient to deal with the challenges emotionally as well as to take care of things administratively and logistically. Also, when we talk about cancer, there is always a social stigma involved with it. So when sarcoma is diagnosed, it affects their work, it affects their relationships. I would like to give an anecdote. I met a lady in the OPD and she was a desmoid tumor patient. She was a female married lady who used to come with her husband. We used to interact with her, and after multiple interactions, we got to know that though she had desmoid tumor, and desmoid tumors are not cancers, she told us that her husband has got separated from her because the wife has been diagnosed with desmoid tumor. So this was a very peculiar situation for us to understand that though desmoid tumors are not cancerous, but the husband could not accept this, and there was a social stigma involved, and it affected her relationship. Also, like India is a big country, as I mentioned, and there are so many languages in the country. It is extremely difficult for patients sometimes to understand the language. So we had patients coming from Kerala, from West Bengal, and they were speaking in their own regional languages like Keralite language, or maybe Bengali language. But then it was difficult for them to communicate about their disease in Hindi, which is the national language of the country, or English. Same way, when we talk about the international patients, so we have so many patients, like patients from Bangladesh, patients from Nepal, and many of them approach us and they want to take treatment from India, but sometimes they find it difficult to travel from Bangladesh to India. The reasons are simple: either they don't get the medical invite or they don't get visa. So these are the challenges that patients face. Because of this, they find it difficult to continue with the treatment. Let's talk about the psychological and emotional barrier. This is an aspect which cannot be ignored at all. So even though if a patient has everything, he has got the right doctor, right support, is financially sound to take care of his treatment. But when the disease is so rare that sarcomas are 1% of all adult cancer, it happens to 1 in a million. So when patients are diagnosed with sarcoma, they feel very lonely. And when newly diagnosed, patients often get shock, they get fear, they get thoughts of worry, they get negative thoughts like, will I survive? Why this has happened to me? Is it because of some bad deeds? So they often start blaming their destiny, start blaming God, and this takes a toll on their mental health. And this leads to more depression and anxiety in these patients and caregivers. So the barriers in sarcoma treatment are much, but now the thing is what we try to do in terms of addressing these barriers. So our modus of operandi is that we go to hospital, we believe in doing the groundwork, we sit there, we talk to patients, we listen to them with empathy, we try to do their emotional counseling so that we can try to relieve their stress and anxiety and hear their concerns. We educate patients, try to increase their awareness, give them information sheet about the disease, what is sarcoma, why is pathology important, what side effects can they face through chemotherapy, how to deal with such challenges, and what side effects can they face from targeted therapies like pazopanib, sorafenib, cabozantinib, regorafenib. Not only this, from the pandemic when it started, we have started an initiative of doing weekly support group meetings. It gives me immense happiness to share that right from 2019 we have so far been able to conduct 275 weekly support group meetings. These are online meetings. They happen on every Sunday at 4 p.m. on Zoom. In these meetings, we invite doctors who are experts in sarcomas. They are surgeons, they are pathologists, radiologists, dietitian. Not only the meetings are based on educating the patients, but we also focus a lot on conducting motivational sessions and sessions based on healing. So we do conduct sessions on meditation. We invite motivational speakers. We invite patients who share their journeys and share their experiences to motivate other people. Also, this is a platform where patients try to interact with each other and they build a strong sense of companionship with each other. Apart from that, we have made WhatsApp groups. We have around 40 WhatsApp groups. They are made disease-wise, state-wise for patients and caregivers networking. And if patients come to OPD and they need any help and support for getting scans and they're unable to do it, we try to provide that support to those patients and help them to get those scans done either on discounted rate or on free basis based on the affordability of the patient. So besides this, we have been supporting doctors in AIMS hospital, and we have supported and contributed in various research papers in the fields of sarcomas, desmoid tumors, and GIST. I would like to share few research papers where we have contributed in what sense. So these are SSS contributions in research papers. This is the first paper that we can see on screen. This was published in March 2022. This is a paper published on desmoid tumors by a team of doctors from AIMS Hospital, Dr. Samir Rastogi and his team. It talks about efficacy and tolerability of sorafenib in desmoid type fibromatosis, a need to review dose. So in this, SSS has supported patients and doctors in terms of supporting for this research administratively. The next is, this is second paper, which was published in 2022. And again, it was done by a group of doctors from AIMS, Dr. Rastogi and his team, which studies about knowledge of patients with sarcoma about their illness, a cross-sectional questionnaire-based study. So in this, doctors have conducted a survey where they have tried to see how much is the knowledge of patients who have been attending patient support group meetings, which are educational sessions organized by Sachin Sarcoma Society. So with the support from SSS, we have been acknowledged in this research paper, and doctors have been able to find out that those patients who were enrolled in this study, who were attending support group meetings, their knowledge about their illness, about their disease, about their treatment was better, had improved considerably. This is the third paper. This is the phase 2 study of gemcitabine and docetaxel combination relapsed metastatic or unresectable locally advanced synovial sarcoma. It's a paper which was published in 2023, again by Dr. Rastogi and his team. This is a clinical trial paper, and this paper was very well supported by Sachin Sarcoma Society. So in this, SSS has supported administratively. Then there is another paper. This is a paper on desmoid tumor, high health-related quality of life seen in depression in patients with desmoid fibromatosis. So in this paper, it was seen that desmoid tumor patients, though it is not a cancer, it is a rare tumor, but these patients, they have a lot of stress, anxiety, and depression. So when we got to know about this, we also try to make changes in our, in terms of supporting patients. We started conducting more sessions, which were motivational sessions in our Sunday meetings. We also started conducting more sessions on meditation, sessions that were focusing on healing, so that we can try to support patients in the best possible way. The next paper is efficacy and tolerability of a low-dose continuous regime of regorafenib in refractory synovial sarcomas. This is a paper which has been published recently in 2025 by the team of Dr. Rastogi and his team. And this is the wonderful paper, which was also supported by SSS in a way that all the patients who were diagnosed with synovial sarcoma and who were enrolled in this study, they were supported with regorafenib by SSS in this study. The next paper is clinic radiological outcomes of fibromatosis after discontinuing the treatment in responders, early results from the SORA-STOP study. This is another paper that was published. And in this paper, again by Dr. Rastogi and his team, and in this paper, we have tried to see that desmoid patients who were taking sorafenib for a considerable period of time, their sorafenib was stopped, and then their results were seen. How the desmoid tumor is responding in their case. Is the disease increasing or is it reducing? And how this is evaluated? This is evaluated by getting their MRIs done. So SSS has supported in this research paper by getting MRIs done for those patients who were enrolled for this study. And we are grateful and we are very happy that we were acknowledged for this contribution in this research paper. So these are some of the pictures of the Zoom meetings, the doctors that have been invited from time to time, and all the patients, they happily talk to each other, they interact with each other, and they build strong companionship with each other. These are some of the pictures that we would just like to show. These are some of the SSS projects that we have been running. So we do various sessions. Our main objective is to spread awareness about sarcoma. We support patients administratively, and we also try to help those patients who need help in the blood. Sometimes we try to support them by giving them employment, and this was our project Rozgar. So we have talked enough about what are the barriers in sarcoma treatment. Now let's talk about solutions. What should be done? So the most important thing that we feel is that awareness is very important in sarcoma, and it is extremely important to create this kind of thing in patients, that if any patient is diagnosed with sarcoma, desmoid tumor, or GIST, he should not take treatment from any other local hospital. He should not get operated from a person who is not trained in sarcoma. He should be directed. he should be referred to a sarcoma clinic and he should be taking treatment from the sarcoma specialist. Because the key here is early detection. If a patient comes to a sarcoma specialist in a non-metastatic setting where the disease is there at only one part of the body, in that case, the treatment is possible. And in that case, definitely it will improve the prognosis of the patient. So here the need is to train pathologists, the need is to train oncologists, to implement standard treatment guidelines. And for SSS, it is more important to continue doing these patient education programs, to have more collaboration with sarcoma experts and partner with other NGOs. So the final thing is conclusion and calls for action, that sarcomas are rare cancers, but barriers are common everywhere. I believe it's not only in India, it's everywhere. Barriers include medical, systemic, financial, social, and emotional barriers. Now, the thing is that if patient comes to doctors at the right time, when the tumor is small, when the tumor is localized, it is at one place, definitely the treatment is possible, survival is possible, the patient can get normal, can continue to lead a life, normal life with dignity. So life after sarcoma is possible. All this is possible only when there is an awareness about these challenges. We all can come together, we can collaborate with each other, and by having empathy for each other, we can bridge these particular gaps. So though sarcomas are rare, the barriers are common, but there is a hope that if we all come together, we all can make a difference. I want to express my gratitude to Dr. Sameer Rastogi, who is from AIMS, and Lakshay Nagpal, my colleague, for his support. Also, I want to express my gratitude to Life Raft organization, Sarah, Rebecca, for giving us an opportunity to present the barriers in sarcoma treatment. Thank you very much.